Well, you might want to check your medicine cabinet.
Another round of blood pressure medicine.
Third recall. Pharmaceutical company after pharmaceutical company.
Every time we hear this news, it is really concerning because these recalls affect so many of us. According to the American Heart Association, about 103 million Americans have high blood pressure. That's half of adults in this country. So what should you do if your medicine ends up on the recall list?
Number one, I would probably tell patients not to stop it without talking to their doctor, just because they're fearful.
Dr. James Park is an interventional cardiologist at Texas Health in Dallas. He says suddenly stopping meds that help your heart to function can cause major problems.
You can get rebound hypertension or very bad blood pressures, or you can go into heart failure if you stop right away.
And look, sometimes doctors become the patient. Dr. Park, who himself has borderline hypertension, takes a medication that was recently recalled.
And of course, I get that warning letter from CVS.
His doctor's advice was to try to get a different medication in the same class. So look, there are 8 types or classes of medicines that help to control your blood pressure, and all of them act in different ways. So some, for instance, will block your blood pressure from getting too high. Others will slow the contraction of your heart, and so on. Announced another recall. One class in particular, called ARBs, has been in the news a lot lately. So these meds aren't just for people with high blood pressure, they're also prescribed for people with congestive heart failure. Well, drug makers said they found impurities in these pills and that those impurities are carcinogenic. You're not going to get cancer because you're taking your blood pressure medication.
That is correct. But I think that we all personally feel we don't want to take impurities in our medications if we can help it. So I myself don't want that either.
The problem isn't with the medication itself, rather with how the drugs are made. With more drug and device manufacturing happening at a smaller number of centers, companies, and countries, Dr. Park says it's important to trace how and where your medicine is made, and by whom.
A lot of these pills are made outside the United States. It's hard to sort of regulate that.
I reached out to the FDA to try to understand their process. Well, they declined an interview and instead pointed me to their website, which shows you a list of recalled medications and the companies that make them, and the list is long.
Yeah, it's alarming.
Now here's the other issue, and a lot of doctors aren't talking about this. Because of all these recalls and warnings, hospitals are now starting to see shortages of some of these medications that are considered safe alternatives.
We've noticed a lot of shortages at our hospital on certain critical medications. So we get warnings and stuff from our system sometimes letting us know, hey, there might be a shortage of this. So be sure to, use them wisely.
Doctors don't usually like the idea of us Googling around when it comes to our health, but this is the exception.